Welcome to this comprehensive walkthrough of the Kosair 400 Patient Warmer to prevent hypothermia and maintain normothermia in patients during preoperative, intraoperative, and postoperative phases of medical procedures. Let us understand what is hypothermia. The regular body temperature of a human is around 98.6 degrees Fahrenheit, 37 degrees Celsius, referred to as the core body temperature. A drop in this temperature results in a condition known as hypothermia, where the body loses heat faster than it can produce it, posing serious risks, especially to vulnerable populations. Hypothermia during surgery, also called perioperative hypothermia, is a common and serious concern in operating rooms. It occurs when a patient's core body temperature drops below 36 degrees Celsius, 96.8 degrees Fahrenheit, during or after a surgical procedure. Why to use Kosair 400 Patient Warmer? Kosair Adult Patient Warmer is used to prevent hypothermia and maintain a normal core body temperature for patients during preoperative, intraoperative, and postoperative phases of surgeries or other medical procedures. It helps to reduce the risk of complications due to surgical site infections, SSI, promotes faster recovery, and improves overall patient comfort and outcomes. The device is equipped with sensors to detect overheating and to maintain maximum patient comfort and safety. A light, ergonomic design and convenient trolley mounting options make the blanket warming unit a desirable choice for patient warming needs. What's in the box? Inside the box you will get a patient warmer device with hose pipe, power cable and one disposable body blanket. Optional accessories which you can opt for are disposable upper body or lower body blanket, reusable full body blanket and a trolley to mount your patient warming device. Now let's see how to set up and use the Kosair 400 Patient Warmer. Attach the air hose to the front air outlet of the warmer. Mount the warmer on the trolley or any flat surface near the patient bed. Now connect the power cable to the patient warmer. Plug the power cable to the power source and switch on the power button on the bottom right side of the device. After switching on the device, the front display panel shows operating fan speed and temperature of the warmer. By default, the warmer is set to ambient temperature. You can set the temperature directly to 38 degree or 43 degree with one button touch. You can adjust the fan speed from the front display panel buttons. And also you can adjust the temperature by +0.5 degrees Celsius or -0.5 degrees Celsius from front display panel buttons. Remove the blanket from the packet and attach the blanket to the hose pipe. Put the device on standby mode after the desired use. Switch off the device. Remove the blanket and dispose it off. Thank you for watching. For detailed instructions and safety guidelines, always refer to the official user manual. If you have any questions, you can email us on sales@dexup.in or call us on +91 738 530 4200.